While as many as 50% of men over the age of 50 are affected by erectile dysfunction, for some of them, fixing that problem isn't as simple as taking a pill. Today, our next guest is here to discuss another solution to this common problem. Please help me welcome Dr. Matthew Mutter. He is a board-certified urologist with NOLA Men's Clinic. Welcome back to the show.
Good morning. Glad to be here.
Glad to have you here. We've done this virtually before, but now we are in person, everybody. And okay, first let's talk about that statistic, right? 50% of men, everybody, over a certain age are affected by this problem. That is a lot, everybody. What is the cause of erectile dysfunction?
In order to really come up with why you have erectile dysfunction, it's important to know how you have proper or normal erectile function. So that is a complex set of events that involves nerve function and blood flow function. If you think about it, the nerves during stimulation will emit neurotransmitters, which then go to the blood vessels, which allow the blood vessels to dilate, and therefore you get better blood flow to the penis and you have an erection. So anything in that pathway that can affect either the nerves or the blood flow can cause erectile dysfunction. Think things like hypertension or cardiovascular disease, diabetes. Diabetes is a big one because it affects both the nerves and the blood vessels. Another common reason for erectile dysfunction is radical prostatectomies or prostate cancer surgery or colorectal surgeries.
Wow, yeah, you all are seeing it right there. Some medication you can be on can also cause erectile dysfunction. And I was asking Dr. Mutter, why is it so common to be talking about this right now? That's because we're seeing an influx of diabetes, these conditions that are really causing more men to have erectile dysfunction. But luckily, everybody, there are actually some solutions to erectile dysfunction. There are about 5 on the market right now that are FDA approved. Talk to me about those different options.
Correct. So, well, first, before we want to talk about medications or treatments, number one with any condition is lifestyle modifications. You want to try and improve your weight, improve your hypertension, or lower your blood pressure, improve your diabetes. So that's a good first start. But again, it's obviously much easier said than done. So when you want to move on to oral therapies, will be your first guideline. Those are the things such as Viagra, Cialis.
Yes.
We've all heard of those. The next one we can talk about injection therapy, and that's just like it sounds. It's an injection. Now I want to be clear when we talk about FDA approval for injection therapy. There are combinations of medications that are used for injection therapy, and the combinations themselves are not FDA approved. There is one medication in the combination that is FDA approved, but so you have to be careful. Some of these are off-label use, which is okay. It's widely used. There are vacuum therapy, which is nothing more than a penis pump, and then finally a penile implant.
Now let's talk a little bit more about this penile implant. How does that work, and how do we know which of these 5 you see here on your screen, everybody, work best for the man who has the erectile dysfunction?
Yeah, that's a great question. So it's important that you come into your local urologist so we can do a very thorough history, physical exam, and then come up with a plan at which would be the best treatment option for you. So for example, a diabetic man, we know that oral therapies are less likely to work in the diabetic man because again, the oral therapies rely on both the nerves and the blood vessels. And so with the diabetes affecting both the nerves and the blood vessels, generally speaking, a diabetic man is less likely to respond to that oral therapy. So while that doesn't mean that we can't initiate that treatment for that man, but at least we have the conversation, says, hey, listen, I'm not entirely sure if this is going to work very well for you, but don't worry, we have these options and this option, and based on, you know, his personal characteristics and his overall medical condition, we can say, you know, I think this is probably the better option.
So talk to your urologist, everybody. It is so important. Now, back to this penile implant, because I've seen a TikTok about this, everybody. Like, how does this work? Like, we have a picture of one. Please explain what's going on here.
So what you see here is what we call a 3-piece inflatable penile prosthesis. So because it's inflatable, you could walk around in your day-to-day activities and no one would really know what's going on. You could walk around in the fitness center, in the shower, no one would know that you have an implant. When the time for an erection comes, you simply inflate it or pump it up, and then you can have an erection sufficient for penetration.
Oh, so you have to do it yourself?
You do.
Now, what's the turnaround time for this? If we choose this option, so I'm guessing they put it inside of us?
Correct. So it's a surgical procedure. It's about a 30 to 45 minute quick surgical outpatient procedure. It's important to know with any medical procedure, complications do exist. But thankfully, the most common things that you can experience with this are pain, which can be part of the healing process, and very rarely rarely an infection. Think on the order of about 1 to 2%. So if you think about it the other way, 98% of men undergoing this procedure generally do well from an infection standpoint.
Very fascinating, everybody. As you all can see, there are options out there. And look, if you want more information about the available treatments for erectile dysfunction, log on to edcure.org or online edinfo.com. If you have more questions, contact Dr. Mutter's office at 504-412-1600. And as you can see here, they have an office located in Metairie.